Hello YouTube, I'm Dr. Tahir from Youthful Medicine. Today I saw a couple of patients who actually are in their post-menopausal, perimenopausal stage, early years of that, and had some hair loss. So hair loss in women could be quite disturbing, and I'd like to share with you some tips, some ideas and maybe options of medications that could be used for patients to help slow the loss of hair and avoiding what we call androgenic alopecia. So hair loss in women with perimenopausal and postmenopausal phases is known as female pattern hair loss. It's also called androgenic alopecia, a term used that their androgens or the hormones that the testosterone type of hormones that are actually changing in the body and can cause hair loss. So there's changes, there's decline in your estrogen and progesterone, leading to the effects of how the male hormones are affecting your hair follicles. So the changes between your estrogens, your progesterone, your testosterone lead to loss of hair. Earlier, one of my previous videos that I created was about how hair loss can be seen in now new treatments for weight loss. So treatment modalities that I use personally are minoxidil pills. Actually, you may have seen topical Rogaine minoxidil. I think it's quite messy. I don't use it in my patient population. It is although FDA approved for the treatment of female pattern hair loss, and you can get a formulation of 2% to 5%, and it takes about 3 to 6 months to see the significant results. But I feel like oral medications have minimal side effects and they have better efficacy. Actually, about a couple of years ago, there was an article in New York Times that talked about role of minoxidil pills for hair loss. And actually, a dermatologist, when they published this study, it actually got a lot of traction. And we saw that definitely there was a role of oral minoxidil in patients, male or female, for the hair loss. So oral minoxidil, you can start with like low dose 2.5 milligram, you can go up to 5 milligrams, monitor for your blood pressure, and monitor and see how it is. It can cause some hair growth in other parts of your body, and you may need to shave more or similar precautions need to be taken. Anti-androgens, so these are some hormonal blockers. So they block the effect of testosterone on your skin, especially scalp. So there's a medication called spironolactone that is also used in polycystic ovarian syndrome. So it's an anti-androgen commonly used in women with hair loss to reduce the effects of dihydrotestosterone, to block it and improve the hair follicles. So it kind of blocks the hair follicles from the effects of dihydrotestosterone, which is the most effective form of or byproduct of testosterone hormone. There's another medicine called finasteride. Though it is more commonly used in men, it can be prescribed off-label in postmenopausal women to block dihydrotestosterone. There's another similar medicine to finasteride called dutasteride, which is it also can inhibit the dihydrotestosterone, and it is also used sometimes off-label in women with for postmenopausal hair loss. Hormone replacement therapy like estrogen and progesterone replacement therapy, they play a great role because estrogen is actually is the reason women have like a lot of good hair. And hormone replacement therapy can also reduce some of the other adverse effects of, or sort of side effects of not having enough estrogen, which we can go into detail in another episode, but this is what I wanted to bring it to your attention. And you have to get hormone replacement therapy from a doctor who's expert in anti-aging and hormone replacement therapy. Topical estrogen creams, some dermatologists, your gynecologists, your primary cares also can prescribe it, and they contain estrogen, and you can use it as one of the ways to help your estrogen requirements. There's another cool treatment option called platelet-rich plasma therapy, which I have gone training for that too. So what it does is they take out your blood, spin it, get the thick platelet-rich plasma and inject it with small micro needles into your scalp. And they actually, you can get these sessions done like initially every 4 weeks to every 3 months, and then once every every 6 months, and then maintenance wise. And they do help regrow your hair because they bring in new blood flow, new growth factors. Microneedling is a cosmetic procedure that is usually done at the medical spas, and you can get that done. And they also cause micro needle injuries. And sometimes I've seen that some of the therapists would do is they would use the platelet-rich solution that you just got, injected whatever is left over, they would just massage it on your scalp to give it some growth of those. Low-level laser therapies to stimulate hair growth are also important. The problem with them is that you have to go to the medical spa, get the treatment and go often enough, but they are making home lower laser therapy lasers that you can use it at home, and as they get better and better, people can do it at their home at the convenience, and it would be a lot more cost effective. Lastly, there are some nutritional supplements that people can take. So biotin, we already know that it is being used and sold in the market for keratin production. So trying it won't hurt you. Making sure you're not iron deficient, because iron deficiency can lead to hair loss. Vitamin D, one of the favorite vitamins, I think it's more of a hormonal support also, should be used and make sure maintained it. If you're low, ask your doctor to give you a higher dose to bring it to a level. And omega-3 fatty acids, they can also promote overall health, inflammation, that can help with it. So prevention, making sure you eat a protein-rich food, antioxidant-rich food with fruits and vegetables like berries, and food that contain vitamin A, C, and E. Omega-3 fatty acids, zinc and selenium, which are usually found in nuts, seeds, and shellfish. They're good for you. And care of your scalp, like regular scalp massages, avoidance of excessive chemicals, and also excessive shampooing is not a good idea. Avoidance of harsh chemicals. Managing stress, which is common, and it's very hard to say that as humans in the complex world that we live in, we won't have it, but try to minimize as much as possible. And improve your sleep. Sleep is one of the most important things that you can do for it. Again, managing your hormones. Another important thing that I would say, check for thyroid function testing, because in perimenopause phase, you can also have thyroid disease. Thyroid, hypothyroid, this is the gland, the thyroid gland that is up there in our neck, that can be low in its function, and it may lead you to develop hypothyroidism, meaning decreased thyroid gland, and that should be optimized as well. So few tips there for you. Subscribe to my channel, share it with your friends and family, so that I understand that it's a useful information for you, so that I can find time and make more of these videos. All right, take care. See you later.